Net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the LiveActiveNow.org fund. I'm Steve Kashul, your Chicago Bulls radio host and co-host here of Sports Medicine Weekly, joined by Dr. Nik Verma this week. He's the head team physician for the Chicago White Sox, also for Midwest Orthopaedics at Rush University Medical Center, and he specializes in shoulders, knees, and elbows as orthopedic surgeon. And subbing this week for Dr. Brian Cole. Did you get your flu shot yet, Dr. Verma?
I did get my flu shot. You know, as a healthcare professional, we actually have a requirement that all employees within the hospital or the medical center are immunized. And that's simply because we come into contact with so many patients that are sick. So basically, we do it to protect ourselves, but we also do it to protect other patients so that we're not passing along disease.
I always want to ask a doctor, all right, so you're going to see a number of patients, and someone comes in, you know they're under the weather, right? They're sneezing, they're coughing, they're wheezing, the whole thing. You don't go in with a mask on, right?
Yeah, I think, especially if you suspect somebody has the flu, that's what you would do. Now, generally, as an orthopedic surgeon, people who have the flu don't show up in my office, but you can imagine that people with the flu go to their regular doctor to help get better. And so those doctors do go into those rooms with protection on to try to avoid contracting the virus.
I have a funny story about that quickly. I remember I had a case of poison ivy, and it was on my hand, and I knew the doctor. I hadn't seen him in a long time. So he comes in, he shakes my hand.
Yeah.
He goes, "What's your problem, Steve?" I said, "Poison ivy." He goes, "No, why'd you shake my hand?" I'll never forget that. But he laughed, we laughed, and he washed his hands, and no, he never got it. That was good. Well, let's bring on our next guest here. He is from Rush at Munster, Indiana. We're going to talk about cold flu prevention and also sports exercise restrictions when you are sick. Dr. Jack Nickless. I love your name, Dr. Jack. Being a golfer, now it's spelled differently than the gentleman who's won 18 majors, but you spell your last name Nickless, but common misconception, right?
That's correct. Similar name. The golf game is not anywhere near similar.
So how many times you play in one of these scrambles and they say, "We're playing with Jack Nickless today"?
It's more of a publicity thing, I think. I kind of ride other people's coattails there. So my golf game isn't that great.
I would expect it to be that way, right? Hey, thanks for joining us here on Sports Medicine Weekly. So we're going to start right with this, Dr. Jack. What are some good general cold and flu prevention reminders?
Yeah, so similar to what you touched on, hand hygiene. That's probably one of the most common things that can help prevent the spread of flu. So you can really track illness from touching door handles or lifting weights in the gym. So you really want to make sure that you're washing your hands frequently or using hand sanitizers. The other thing is exercising. Regular, moderate intensity exercise can help boost the immune system and help keep you healthy throughout the flu season. And finally, as Nik Verma touched on, you want to make sure that you're getting your flu vaccine. This really helps prevent the spread of disease and protects you during the flu season.
So, Jack, along those lines, I get a lot of patients that come into the office or players that ask us about flu vaccines, and their concern is, well, I don't want to take it because I'm just going to get the flu. Can you talk about the risk of actually getting the flu related to getting a flu shot, and how effective are they in preventing somebody from getting the flu?
Yeah, it's a great question. So getting the flu from the flu vaccine is a very common misconception. You cannot, in fact, get the flu from the flu vaccine. What happens with the vaccines is they're created by weakened or killed viruses. So your body does have an immune response. So patients can get some very mild muscle aches, low-grade temperatures, really just not feel well for a couple of days. But those symptoms are extremely mild compared to getting the actual flu. So the risks and the benefits, not even close. So definitely get your flu vaccine. In terms of actual side effects, there's very few side effects that should prevent you from getting the flu vaccine, and one of those is a severe reaction to the vaccine or one of the ingredients. So if you have trouble breathing after getting the vaccine or tongue swelling, things like that, that would be one reason to prevent you from getting the vaccine.
He is a sports medicine specialist and shoulder specialist from Rush in Munster, Indiana. Okay, so people want to know this, Dr. Jack. If we do get sick with flu symptoms, when should you see a doctor against, just using drugstore remedies?
Sure. So if you're having severe symptoms, fevers, severe muscle aches, you can't keep any fluids down, that's a time when you want to go see your primary care doctor as soon as possible. There are medications that you can use to treat flu symptoms, which help decrease the severity of symptoms and help decrease the duration of symptoms. But those medications are best used within 48 hours of the symptom onset. So you really want to get to the doctor as quickly as possible. Now, if the symptoms are more mild, little sinus congestion, mild cough, certainly you can use over-the-counter medications and remedies, but it never hurts to check in with your primary care doctor and make sure that those medications are safe for you to be taking.
Jack, the other thing that I think happens is that people don't really understand what is really the flu, right? Every time you get sick, you've got a runny nose or a cough, people say, I'm down with the flu. But the flu is a very specific virus that causes severe illness and really can have a risk of even mortality, meaning death, in certain individuals that are high risk, that is young individuals, children under 3, or older individuals. Can you talk specifically about what is in fact the flu and how does it differ from just your common cough or cold?
Sure. So the common cough or cold, there's many viruses that can cause that. And those symptoms are relatively mild in comparison to what the flu can cause. The flu is a variation of multiple strains of a specific virus that can affect the body, and it really puts those who have lower immune systems at risk. So people who have asthma, diabetes, or other medical conditions can be at a higher risk for complications due to the flu. So like you had mentioned, the flu can cause significant complications and causes a large number of hospitalization or even ICU admissions per year. So mortality is something that we certainly try to prevent and is one of the major reasons for getting the flu vaccine.
It's certainly nothing to take lightly, I think, is the take-home message for people who may have the real flu.
Visiting with Dr. Jack Nickless, and also our guest host this week is Dr. Nik Verma. I'm Steve Kashul at Sports Medicine Weekly. Question for both you gentlemen. All right, so we've all felt crummy at times, and yet I enjoy working out. I never do on the weekends, really, because my kids' sports, but if I can go 4 or 5 days a week, I will. And we always talk about or hear about, hey, I'm feeling crummy today. Well, if I'm not in bed, sometimes the workout makes you feel better. So, Dr. Nik, I'll start with you. Do you suggest that? I mean, I know there's different cases, if you're feeling horrible with fever, stay out of the gym. But sometimes, those little cold or something, if you go in a sauna, if I get a good run or something, I won't go the full 45, 60 minutes or maybe something you typically do. But if you can get a nice little 20 minutes in and get a sweat going, that could be a positive on your body, right?
Yeah, no question, Steve. I agree with you that if I have a minor cough or cold type symptoms, I think a workout often helps you feel a little bit better, more reinvigorated, so to speak. There are some absolutes, and I think Dr. Nickless can help us with that. This comes up for us in the training room situation, right? You've got a guy who's got a 7 p.m. game, and we've got to make a decision. Is it safe for him to play? Either A, is he physically able to play, and then B, is it safe for him to play? So, Jack, help us to understand what are kind of the absolutes in terms of when athletic participation should be restricted based on symptoms.
Sure. That can be a really difficult decision to make since there's not very firm guidelines on that. The really 2 firm guidelines that we do go off of are if an athlete is having active fevers, they should not be participating in any sports. The fever can increase your metabolic demand, increase your resting heart rate, and increase your cardiopulmonary demands, which really puts you at risk. So should certainly avoid exercise if you're having fevers. The other reason to avoid exercise would be if you're unable to stay hydrated. So if you're having nausea, vomiting, diarrhea, and you can't keep up with your fluids, you should certainly rest and not be participating in sports or exercise activities.
Do you guys have a rule, Dr. Nik, with White Sox players getting flu shots or something, some immunization or something before the season?
We don't have a rule per se, but it's offered to all of our athletes. Okay. Fortunately for us, most of our season exists outside of the typical flu season, so to speak.
Right.
But we do encourage. We check all of our vaccination status on all of our athletes for the typical things that all of us are vaccinated for as we're younger. It becomes a bigger issue when we have players coming in from other countries. particularly South American countries where vaccinations may not be available at young ages. So we've got to always confirm that they've had appropriate vaccinations, and if they haven't, they get updated. But we give the flu shot to all of our athletes, or at least offer it to them and help educate them regarding what are the benefits. And I would guess, especially with the Bulls being a winter sport, that they would do the same things there as well.
Guys in Cuba, do they get the flu shot?
I don't know.
Have they ever had it before? I wonder.
Well, it's not the flu shot so much as many of those guys will come over and not had all of the normal vaccines that we have as a child.
Right.
And so we are sometimes doing vaccines that you would typically do on a 5-year-old on an adult athlete because they just haven't had it based on the country they've come from.
Wow. Dr. Jack, you echo that?
I do. That's something that we always try to look out for when covering professional sports teams in particular. When you're getting athletes from other countries, you certainly want to make sure that you're checking up on that to help protect the athlete and help protect the team as well.
Great stuff. Dr. Jack Nickless from Rush University Medical Center, Munster, Indiana. Hey, thanks so much for helping us out today, Dr. Jack, on here for Sports Medicine Weekly.
Thank you for having me. Appreciate it.
All righty. We're back with more after this. Stay with us. And still ahead, we're going to have our Ask the Doctor segment, always a staple of the show. You're listening to Sports Medicine Weekly, only on 670 The Score.